This is The Week in Addiction Medicine, a podcast resource of timely news and top stories brought to you by the American Society of Addiction Medicine, ASAM.
Today is Tuesday, July 22nd, and I'm Zach Caruso. Our lead story this week is from Humanities and Social Sciences Communications and is titled, Did Alcohol Facilitate the Evolution of Complex Societies? This study tested the drunk hypothesis, which claims that alcohol promoted social bonding and cooperation, aiding the rise of complex societies. Using data from 186 non-industrial societies, authors found a modest positive link between indigenous alcoholic beverages and political complexity, even after controlling for ancestry, environment, and agriculture. Results suggest traditional fermented alcohols provided social benefits that helped societal evolution. However, other factors like agriculture and religion were likely more effective drivers. A new article in the Annals of Internal Medicine is titled Vaporized Nicotine Products for Smoking Cessation Among People Experiencing Social Disadvantage, a randomized clinical trial. This randomized clinical trial examined whether vaporized nicotine products, or VNPs, are more effective than gum or lozenge nicotine replacement therapy, or NRT, for smoking cessation among socially disadvantaged adults in Australia. A total of 1,045 daily smokers receiving government pensions were assigned to 8 weeks of either VNPs or NRT with text message support. At 7 months, the 6-month continuous abstinence rate was 28.4% for VNP versus 9.6% for NRT users, showing VNP superiority. Adverse events were fewer in the VNP group. VNPs offer a promising cessation option for socially disadvantaged smokers. Next is an article in Regional Anesthesia and Pain Medicine titled Risk of Dementia Following Gabapentin Prescription in Chronic Low Back Pain Patients. Gabapentin is commonly prescribed for chronic pain, particularly neuropathy, but there has been question about potential increased risk of dementia. Prior studies have had conflicting findings, so authors used the TriNetX national database to assess association between gabapentin prescribing for patients diagnosed with chronic pain and diagnosis of dementia and mild cognitive impairment, or MCI, within 10 years. Overall, 6+ gabapentin prescriptions were associated with increased risk of both dementia and MCI. When stratified by age group, there was no significant difference in dementia or MCI among those 18 to 34, but it was increased in all other age groups. In addition, authors found those who received 12+ prescriptions compared to those who received 3 to 11 had higher incidence of dementia and MCI. Next is a study in JAMA Network titled Clinical Decision Support System for Primary Care of Opioid Use Disorder. Primary care physicians report reluctance to provide MOUD, so this study evaluated a clinical decision support system, or CDSS, embedded in the electronic health record to see if it could improve diagnosis and treatment for OUD in primary care clinics. While the study did not find an increase in OUD diagnosis, there was an increase in naloxone prescribing and MOUD prescribing or referral to OUD treatment. There was not an increase in median days covered by MOUD in 90 days post-visit. The authors posed that the CDSS could improve access to MOUD in primary care settings. Our next article is in International Journal of Drug Policy and is titled Changing Trends in Non-Medical Gabapentin Use Among a Cohort of Rural Appalachian People Who Use Drugs, a longitudinal study over the time period of scheduling changes in Kentucky. This is a secondary analysis of a study of people who use drugs in rural Kentucky from 2008 to 2020. In mid-2017, Kentucky became the first state to classify gabapentin as Schedule 5. In 2008, none of the participants reported non-medical gabapentin use, rising to 56% by the final interview, passing opioids to become the most prevalent substance used in this group. The greatest rate of increase occurred between 2013 and early 2017 and continued to increase after it was scheduled in mid-2017. During the same period, opioid use decreased from 99% to 54% of participants. There was also a significant increase in the use of methamphetamine. Prior to being scheduled, 55% obtained gabapentin from regulated sources. This decreased to 35% after scheduling. In conclusion, in Kentucky, there was a dramatic increase in non-medical gabapentin use between 2008 and 2020, and that the scheduling of gabapentin in 2017 did not reverse this trend. Next is a study in JAMA Network Open titled Alcohol Use Disorder Treatment Availability at Mental Health Treatment Facilities. Among adults with mental illness, 18% have co-occurring AUD, but only 8% receive treatment, and under 2% get MAUD. MAUD reduces drinking and harms, and remission improves when both conditions are treated. This study analyzed 2023 U.S. data from 6,572 facilities, comparing mental health only and combined mental health and SUD centers. While most mental health facilities offered SUD treatment, only 10% provided MAUD versus 41% in combined centers. Limited MAUD access may stem from staffing, knowledge, and resource gaps, suggesting integrated care could improve treatment availability. Our next article is in Drug and Alcohol Dependence and is titled Prevalence of Congenital Heart Defects Among Children with and Without Diagnosed Fetal Alcohol Spectrum Disorders, 2016 to 2022. This study of congenital heart defects, or CHD, and fetal alcohol spectrum disorder, or FASD, used insurance claims data for 9 million children enrolled in Medicaid and 11 million children enrolled in commercial insurance. In the Medicaid group, 0.05% had FASD, and 5.2% of these had CHD, compared to children without FASD, where 1% had CHD. In the commercial insurance group, 0.01% had FASD, and 3% of these had CHD, compared to children without FASD, where 0.6% had CHD. The degree that FASD increased the odds of CHD was similar for the two insurance groups. Prenatal smoking exposure was not a likely cause of the increased odds of CHD in children with FASD. Our final article is in the Journal of Addiction Medicine and is titled Cannabis and Cannabinoids for Treating Pain. What are the data? In this commentary, authors discuss the current evidence for use of cannabis and cannabinoids to treat pain and note that it is limited. The authors highlight concerns that public perception does not match current evidence and that the potency of cannabis has increased in recent years, potentially increasing the risk of serious health consequences such as psychosis. Currently, there are no FDA-approved cannabis or cannabinoid formulations for treatment of pain, and additional and rigorous research is needed. Further, if a formulation is approved, FDA approval is generally narrow and approves specific formulations for specific conditions and is not in line with the current commonly held concept of medical marijuana. This concludes today's episode of This Week in Addiction Medicine. Remember to subscribe to the ASAM Weekly for more exclusive content and our editor's commentary delivered every Tuesday. Be sure to check us out on social media and at asam.org. Thanks for listening. We'll be back next week.